This is a brief demonstration of a gastric electrical stimulator placement. I start by measuring a spot 10 centimeters proximal to the pyloric sphincter valve on the greater curve of the stomach with this marking tape here. I make a little mark with a burn to know the appropriate location for the stimulator leads. Then the leads are placed into the abdominal cavity with a needle that helps drive the leads through the stomach. And the needle is driven through the muscular layer of the stomach from the greater curve to the lesser curve and out. And this needle helps drive the suture, and then ultimately following this is the lead through the muscular layer, so we know it's going to be able to deliver electrical stimulation to the stomach. So that's the first lead there, followed by a placement of the second lead about 5 millimeters proximal to this, again completely through the muscular layer of the stomach from the greater curve towards the lesser curve, and going through the muscular layer. Then the appropriate gastric tissue will be appropriately stimulated by the device, the leads, and the pacer. And these are little caps that are placed on the other side of the stomach to help keep the leads in place, prevent them from slipping. So the needle is used to go through the disc, and the disc keeps everything pinned against the stomach. And then once everything's in place, you can see the leads there now going from one end of the stomach to the other. And then these discs will be sewn in place. I use a permanent suture, in this case braided Ethibond suture, on either side of the disc, on both of the two discs for both of each lead, and then cut in place. So I'll suture each of these with a permanent suture to again help keep the leads in place and prevent them from slipping. And then suture is again used to keep the other side of the leads in place on the greater curve side of the stomach, again using a little bolster device, a little piece of plastic on the leads. We'll sew this in place with a permanent suture to again keep the leads from slipping. And then once this is done, the leads are brought out of the ports and the port is removed, and then they are attached to the generator device that is placed and sutured into a subcutaneous pocket in a comfortable location for the patient. We check the device to make sure it's working at a level 1 setting prior to leaving the operating room, and patients go home the same day. And this is what it finally looks like when the leads are implanted in the stomach. Thanks so much for watching. Please subscribe to watch more videos.